Dr. August Beer, on August 24, 1898, asked his assistant, Dr. Hildebrandt, to perform a lumbar puncture on him 8 days after he first performed it on a 34-year-old patient for excision of a tuberculous capsule at the ankle joint. Beer wrote that he did not feel any discomfort except for a quick flash of pain in one leg at the moment the needle penetrated the meninges. Unfortunately, the experiment was not successful because of an error. The syringe did not feed the needle tightly, and consequently, some cerebrospinal fluid ran out and most of the cocaine was lost. No sensory loss ensued. Dr. Hildebrandt immediately offered to submit himself to the experiment, which was successful. Both of them went to eat after the experiments were performed on their bodies. We had no physical discomfort, we ate, drank wine, and smoked several cigars, in their words. However, next morning, after a 1-hour morning stroll, Beer felt a slight headache, which increased in intensity during the course of the day. 9 days after a puncture, all the symptoms disappeared. After 3 more days, he was able to go on a train trip without discomfort and was fit enough to participate in a strenuous 8-day hunting trip in the mountains. This was the beginning of spinal anesthesia. Today, many millions of patients worldwide are anesthetized, each by spinal anesthesia for cesarean sections as well as for orthopedic, urologic, gynecologic, and other general surgeries. The problem with the spinal needles used by Dr. Beer and afterwards was that it caused severe post-dural puncture. James R. Hart and Roland John Whittaker published in 1951 a study describing a conical tip and sided orifice spinal needle. Whittaker was a famous anesthesiologist at this time and became president of the American Society of Anesthesiologists. Unfortunately, he had an early death in 1956 at age 46, so the first pencil point spinal needle is named Whittaker needle. The next big event in the design of spinal needles was performed by the German physician Jürgen Sprott in 1987, nearly 37 years after the Whittaker proposed needle, suggested some modifications to it, an elongated tip in an attempt to promote a more gradual separation of the dural fibers, and in particular a lateral orifice larger and oval. This larger orifice intended to facilitate the flow of cerebrospinal fluid and allow a better dispersion of the anesthetic solution administered. Some of the criticism of these changes were based on the fact that the long end was more susceptible to trauma and subsequent breaks, and the side orifice too long could lead to an incomplete insertion into the subarachnoid space with loss of part of the anesthetic to the epidural space. In the early 1990s, the orifice was slightly reduced and the models produced as a way to minimize these inconveniences. Dr. Joseph Eldor, Israeli anesthesiologist, is a contemporary researcher and a strong promoter of regional anesthesia techniques. In 1996, Eldor described a conical tip needle for use in spinal anesthesia. It is a needle with a tip similar to Whittaker but with a twist. Instead of a single lateral orifice, it has 2 contralateral openings. Each of these holes in the needle is smaller than that described in the Sprott needles, but the sum of its areas equals the size of its oval orifice. The idea behind the double hole is to allow a better dispersion of the anesthetic in the cerebrospinal fluid, minimizing failures and neurological complications arising from the bad distribution of the anesthetic reported with small bore needles. It also allows a faster flow of cerebrospinal fluid when compared to the single orifice needle. In that regards, the Eldor spinal needle, double hole pencil point spinal needle, is a real breakthrough in spinal anesthesia and opens a new frontier for regional anesthesia. Its main benefits are 3.5 times better cerebrospinal backflow than any other pencil point spinal needle, faster onset of spinal anesthesia than any other pencil point spinal needle, 5-fold increase in the immediate dispersal area compared to any other pencil point spinal needle, stronger than any other pencil point spinal needle, 1.8 times less backache than any other pencil point spinal needle, less transient neurological symptoms than any other pencil point spinal needle, much less post-dural puncture headache than any other spinal needle.